Hello and welcome to this video that is about recording a well child check if you are a medical student at the Family Care Center. And so just like the prior videos, we are going to look and see that we're seeing today a patient named PD Test who is showing up on the schedule here and has arrived. And so to open the chart, we'll click on that and go to Open Chart. And just like before, we can quickly get a summary. You can see this child has a history of recurrent otitis media but is on no known medications. And here is the office visit. And so to open it up, we will double click on the office visit. And that brings us right to it, where we can scroll down and see the vitals that the nurses have entered, and the weight and the height and the blood pressure and the visual acuity 2020 and 2025, and then the blood pressure. Now, unlike other forms where all of the templates have already been added, this one's a little different. And so the way we figure out which form to add is you go to the Add Forms Well Child Check form, and you can get to it either by double clicking here or over here on the left. And let's say we double click on it, and that brings us to this component, which has a lot of buttons. And the buttons just depend on how old the kid is. So this is a 5-year-old here for a well child check, so we click on 5 year, and that will add the 5-year-old well child check form to the note. And that we can get to by scrolling, hitting here on Next Form. First you come to the Immunizations form, and then we'll click Next past that to get to the Well Child Check form. And you can see that this form has a series of 4 tabs across the top, and what you're going to do is go through all of these with the patient and his parent. And you really want to document pretty much everything and go through this form. This form is much more prescriptive than many of other forms that are more open-ended. But we want our well child checks to be fairly structured. And so let's say you're taking the history from the mother, you can just type M there and mother will pop up. And then you can scroll down here and click on, let's say there's not healthy eating habits. You might type in drink soda twice a day. And you can go through discipline problems again, yada yada yada, and bedwetting, yes or no, and let's just say no. And this present history box is a place really for just typing in the history of present illness. If the mom has any concerns today, such as has a rash or whatnot, you can type in all of the history here that the mom gives you. And then just below that are a set of buttons to click for the developmental history. And these are age appropriate. So if you're adding the 2-year-old well child check form, of course you will have developmental questions that are appropriate for a 2-year-old. So at 5, we should expect the kid to be able to do these various things, or at least to be getting close to doing them. So you go through them one by one, and some of these you actually have to watch the kid do. So for example, draws a 6-part person, you want to give the child a piece of paper and maybe your pen and ask them to draw a picture while you're taking the rest of the history. They should be able to pick a longer line of 2 lines, and they should be able to copy a square. And again, you're doing that with the kid and a piece of paper. It works very well. Likewise, you should have them do the heel-to-toe walk and see how long they can balance. See if they can name several colors. You can use the color green, which is right here on the screen, and maybe the child's shirt or what other things for color. And then here's a set of words to define, and you should just ask the kid to do their best to explain what they are. They won't do like a dictionary definition, but they might be able to explain that a banana is something you eat, and then they know what that word means. Okay, so once you've finished all the history elements, you go on next to the Past Family Social form, and this just looks like the Past Family Social form you've seen in other office visits. And you want to make sure you always go through this during the well child check. So you might make sure that recurrent otitis is all there is in this child's history. And if that's all, there's nothing new to add, you can click on Reviewed, No Changes Required, and that will add the past history to the note. You can, let's say you might add that the sister was diagnosed with eczema. So that would then add that to the note. And the social history, you can see here it says lives with parents, brother, sister, and is in preschool, but this child is now 5, so that was last updated a year ago, so you might say kindergarten. And you might say the name of the school and that sort of thing. and no one smokes at home. And so you could say here, adult smoking in the house, none. And here you can again type, if you haven't typed it up above, you can type, this is just a reminder to type who lives with the patient, because that's important to document. There's a button here if they have any history of involvement with DCYF. We want to make sure we're asking and we're keeping track of that. And here's a place for the surgical history like you've seen before. Now, once you're done with all the history, it's time to go on and do the physical exam, which you would, of course, get away from the computer and just do the exam. And I'll point out that, in general, you should always have a child or an adult who's here for a full physical get undressed and get into a gown to do a well child check. And actually, at age 5, I actually put them in a gown, even though it's massive on them. They're more comfortable if they're somewhat covered than just if they're sitting completely naked. But then for documenting it, this looks familiar like all the things you've seen before, where you can just type in individually certain things. But there's also a normal button, so you can click this and then all of this will populate as all normal. You do have to be careful that it can be very easy just to click a button and have everything populate, but you have to make sure that everything actually really is normal before you do that. And I'll point out, let's say the kid has you diagnose the rash. Let's say they have, tinea corporis on left arm. Let's say that was the rash the mom was worried about. You can put that here, and then you can click normal, and you'll see that everything fills in as normal except for the skin exam. That stays the way you had left it. So you can. The way I usually do this is to document all of the abnormal things that I found, and then click normal to make sure that I've documented everything else. Okay, and then after the physical exam, we move on to the anticipatory guidance. And you can see there are a bunch of topics here to talk about with the parent and the child. And you should go through all of them. And if there's any that you're uncertain about, like exactly what to say about booster seats, if you can't remember what a 5-year-old is supposed to be in, then just leave that blank and run that over with the preceptor so the preceptor can go through that with the patient. So let's say you've gone through them all. You can actually click on this and it'll populate all of the check boxes if you've gone through them all. You then should move on to the assessment and plan. But actually, before we do that, there's a useful thing here. There's a button here for printing a handout. And I always try to give patients a handout about well child checks when they're here. So if you click on here, it takes you to a list of handouts that have to do with well child care. And if you scroll down to the bottom, you will find a bunch that are called well child care and then a particular age. And so if we get to the 5-year-old well child check, we can just click on that and then click on print. And just to show it to you, you can click on preview and see what it looks like. And here's, physical development and emotional development, social development, things that the parent should be expecting. It's useful information, and so I usually print this out for parents at any age group. Okay, so now I'm going to close the handout and go back to the note. And I'll point out that we now need to get onto the assessment and plan. And the way to do that is to click on the assessment and plan button. And by clicking on that, that adds the assessment and plan form to the end of the note, which I can now reach by clicking on next form. And here it is. Now this looks a lot like assessment and plan forms for adults, except that it has this extra set of questions around developmental concerns. And so you can click on whichever one you feel is appropriate. Let's just say this child is developmentally normal. I click on that. And now I go down here to type my assessment and plan like I normally would. And so I can see that this child has only one problem in the problem list. And let's say I'm going to assess that as, follow up with ENT. There we go. And then for the well child check, all you have to type is a well child check. Again, you don't have to add the problem to the problem list. Just type it in here. And then the plan might be, anticipatory guidance, and shots given, follow-up in 1 year. That might be all you need to do for a well child check, except let me point out there's 2 things we haven't done that you have to do at every well child check. And one is to look at the growth chart. Now, to find the growth chart, you have to be in the update. So here we are in the office visit, in the well child check note, and all you do is you click on graph up here in the upper left. That brings up a little window, And in that window is the growth chart button. And if you click on that, it takes you to this child's growth chart. And you can see here's the stature versus age. And today's entry is in gray. All the prior historical ones are pink. And you can see this child's right along the 50th percentile. I can actually click on any one button to see what the details were. So that one was, at 3 years, 3 years, 8 months, he was 99.1 centimeters or 39 inches. Okay, to get to the next chart, we click on next over here, and that takes us to the weight versus age, and you can see again this child is growing perfectly well right along the 50th percentile. I can click on next graph again, and the next one that comes is weight versus stature, which we don't actually use very much. It's the one after that that we really pay the most attention to, which is the body mass index, or BMI, versus age, and again this child is doing very well. I also will point out here it's nice to often to print the growth charts for parents, partly just because it's often only one of two parents who makes it to the visit, and this way you can give them something to take home and show to the other parent if there are two parents at home. Okay, that's the growth chart, so we can close that and go back out to the office visit. The other thing we haven't looked at are the child's shots, and the way to find that is to go to the History tab. So when you first click on the History tab here, the default view is that it will take you to the person's past family and social history, like you've entered into the note already. But you can skip past that and go right to the immunization view by just clicking on this little pull-down menu and scroll down to immunization history. And here you get a nice graphical representation of the dates of all of this child's shots. And you can see actually, if you know the shot schedule, this child is actually up to date. It's had 3 Hep Bs and 5 DTaPs and 3 Hibs and 4 polios and so on. And this child's actually up to date, except that they last had a flu shot in 2012, and maybe by now it's 2013 and they actually need a shot. So we would now go back to the office visit and where we are in the assessment and plan, and let's say we might want to say that actually we gave the flu shot given instead of just shots in general, because that's the only one this kid needs. And to get the shot actually given, you would tell the nurse, and she will do it for you. And that is it. That's all you do for a well child check visit. It's pretty straightforward. And have a good day. Bye-bye.